Welcome to our 7th annual Shine a Light on Lung Cancer here at UPMC Hillman Cancer Center. I'm Laurie King, social worker and patient navigator. This event is held in November, which is Lung Cancer Awareness Month. And nationally, this is the 12th annual Shine a Light. It's anticipated that across the country, there will be 200 Shine a Light events in November of 2020. It is our honor to be a part of the largest coordinated awareness event of lung cancer. And it's our desire to provide education, support, and inspiration to all who attend. Education by discussing screenings, the latest advancements in treatment and research. Support by letting you know that our medical team here, who is here for you at UPMC Hillman Cancer Center through your journey. The Go-To Foundation for Lung Cancer is the largest lung cancer foundation that provides current, credible information to make informed decisions to extend survival. And they are the founders of the Shine a Light. And also our supporting sponsors, Lilly Oncology and others. At this time, I'd like to turn it over to Dr. Ganga Ranasauryia. She is a dedicated pulmonologist at UPMC. During her talk, if you have questions, we would encourage you to use the question and answer feature and put in your questions, and we can address those at the end of her talk. Dr. Ranasauryia?
Good evening, everyone. Thank you so much for joining us. It is an honor for me to be here at this event and shine the light on lung cancer. Thank you so much, Laurie and organizers, for having me. As you heard, November is Lung Cancer Awareness Month. Every day, a little over 400 Americans will die from lung cancer. Really, more people would die from lung cancer than colon, breast, and prostate cancer combined. And there are twice as many deaths from lung cancer than breast cancer, for example. A new diagnosis of lung cancer is made literally every 2.5 minutes. So what can we do about these statistics that are so awful sounding? We really should start with awareness of lung cancer, learning more about the disease, what causes it, how to prevent it, how we can detect it earlier, and how we can be treating it the best that we can. Lung cancer does not discriminate. It can affect men, can affect women, all ethnicities. But 60% of men and women diagnosed with lung cancer are generally former cigarette smokers. About 20% are current people who smoke. And actually 18 to 20% are non-smokers. Non-smokers who are exposed to secondhand smoke are 20% increased chance of developing lung cancer. Other causes of lung cancer include things like radon. Radon is a radioactive gas that is odorless, it's tasteless. It comes from the breakdown of uranium in soil. Other risk factors for lung cancer include exposures to asbestos from work-related exposures, for example, arsenic, that's a chemical. These can all increase the risk of developing lung cancer in patients. And if you see patients who have a history of smoking along with that, their risks are definitely more than 6 to 12 times that. Other things like prior history of radiation treatment, such as breast cancer radiation treatment, can predispose patients to developing other types of cancer like lung cancers too. And genetic predisposition, such as family history in family members, when usually first generation relatives. So even though not all lung cancer is preventable, if we focused on helping our community with quitting smoking, giving our patients the right advice and tools on how they can begin their journey with quitting smoking, we may be able to make a dent in the number of people being diagnosed every year with lung cancer. So talk to your family doctors, talk to your family, friends, make a commitment to quitting. And of course, the sooner, the better. If you do smoke, do it outside your homes to limit the exposures to children and other adults from secondhand smoke that has also proven to be just as dangerous. Sharing the knowledge of the symptoms of lung cancer is another very important aspect of awareness to our community. Red flag symptoms that you hear of, such as coughing, but coughing for several weeks and months, coughing up blood, losing weight, losing your appetite, shortness of breath, shoulder pain are among some of the most common symptoms that need to be alerted to your doctors. Symptoms usually, however, they usually occur when the lung cancer is relatively advanced, spread perhaps. And this is why lung cancer is the #1 cancer killer, but really doesn't need to be that way. Lung cancer screening, just like we have breast cancer screening with mammograms, colon cancer screening with colonoscopies, lung cancer screening with a low dose of radiation, CT scan of the chest, is possible to detect lung cancer early and detecting it when it is most treatable and even perhaps curable. Screening is a game changer, and those who fit the current high-risk criteria should really consider getting screened. What are these criteria? In our population of men and women who are aged 55 up to 77 years of age, who have a history of smoking of at least 1 pack of cigarettes a day for 30 years or longer, or 2 packs of cigarettes a day for 15 years or longer, and even if they have quit smoking in the last 15 years, they would be able to get a low-dose radiation CT scan that is considered a lung cancer screening scan. It's limited to this criteria at this time. It doesn't include anyone who has a family history or significant chemical exposures, and that research may be ongoing, and we may see this change in the next decade. At this time, about 16% of all lung cancers found are usually detected at an early stage. But we know that the survival from lung cancer is the 5-year survival is only predicted around 19 to 20%. But the cancer survival will be so much greater and up to 92% if detected early on at a stage 1, as opposed to 0 to 10% chance of survival for 5 years if it's stage 4. So the earlier we detect this, the better, so that we give our patients a better chance of not only cure, but a better quality of life. And at our UPMC Hillman Cancer Center and our UPMC Susquehanna Lung Center, with the support of radiology, we have this ability to do low-dose radiation CT scans for cancer screening in particular. The scan itself lasts a couple of minutes. No IVs involved, no contrast or dye involved. The whole process would take about 10 minutes in and out. And any abnormalities seen on that may require either observation or additional tests. Medicare and most other insurance plans would cover this screening scan for eligible patients. So at UPMC Hillman Cancer Center, we are able to help a great population of patients with a new diagnosis of cancer. Several specialists are involved in providing a comprehensive lung cancer care team. Pulmonologists like myself are lung specialists who are among the first specialists you may meet in the treatment and diagnosis process. Medical oncologists, radiation oncologists, thoracic surgeons, and several other staff, including nutritionists, dietitians, the nursing staff, phlebotomists, are all a cohesive group of specialists who are trained well in cancer care. Among this support services that we have through the UPMC Hillman Cancer Center include palliative care and pain management as well. In the past decade, there have been several advances in the modalities of diagnosing lung cancer. Previously, it would be an invasive surgical procedure, which really now has become much more minimally invasive options. Pulmonologists would do bronchoscopy procedures, where we can do procedures minimally invasively inside the lungs to get a diagnosis of either lung nodules or lymph nodes that are enlarged. CT-guided needle biopsies that can be done by interventional radiologists, and also minimally invasive procedures that are offered by our surgeons, the thoracic surgeons. Several improved surgical techniques have really allowed our patients to get surgery to remove lung tumors in early stages without the worry of terrible scars or terrible recovery time. At UPMC Hillman Cancer Center, through our thoracic surgery team, we are able to offer robotic lung resection surgeries and lymph node dissection procedures. Several advancements also in radiation oncology services, including stereotactic body radiotherapy as well. UPMC Hillman Cancer Center is actually it's the only National Cancer Institute affiliated comprehensive cancer center in our region. What does that mean to our community and our population in the area? We're able to provide access to state-of-the-art and evidence-based cancer care to our patients. This also includes access to clinical trials and ongoing research. Some of the main advancements in medical oncology and treatment options in the last 5 to 10 years have been the development of immunotherapy and targeted therapy for cancers, and for lung cancer in particular. This has really revolutionized how treatment can be targeted to only trying to focus on cancer cells. Chemotherapy has been available for several years, and it has developed since then, where chemotherapy would affect all cells and has more side effects, and targeted therapy would focus on the cancer tumor cells itself and attack it in different ways that would stop its growth. It's a highly precise way to fight cancer. As a pulmonologist, I encounter lung cancer patients and their families and caregivers on a daily basis, and I help diagnose their cancer. And I have the difficult task of delivering their new cancer diagnosis. And I can tell you that it is always a humbling moment. A diagnosis of lung cancer can leave you or your loved ones feeling uncertain, anxious, overwhelmed. There are important decisions, treatment decisions to make, emotional concerns to manage, insurance, financial paperwork to organize, and really among other practical concerns. It is helpful to keep in mind that there are many sources of information and support for people and patients coping with lung cancer diagnoses. And by learning about the diagnosis and its treatment options, communicating with your healthcare team, you will be able to surround yourself with a support network. You will be able to better manage your lung cancer and experience a better quality of life. Thank you very much for joining us this evening. If you have any questions, please feel free to send them our way.
Thank you so much, Dr. Ranasauryia. You have given us a lot of information, and we really appreciate your input. Our next speaker has been on the journey of receiving a lung cancer diagnosis and following through with treatment. And I will let James Riggle tell his inspiring story.
Hello, I am James Riggle. When I was almost 30 years old, I was diagnosed with sarcoidosis, which is an inflammatory disease that causes clumps of inflammatory cells in various organs in my body. And at the time, it occurred in my eyes and caused scarring. After being treated, I was told that it was under control, but it would always be in my body and most likely would come back later on in life. Almost 40 years later, it appeared again. November 7th, 2017, I had fallen in some wet leaves and started to notice blood in my urine. My family doctor ordered a CAT scan, which included the bottom portion of my lung. And a spot was noticed at the bottom of the lung, and another CAT scan was ordered to be able to see the whole lung area. An appointment was made with Dr. Ganga Ranasauryia, the lung specialist at UPMC. And Dr. Ranasauryia ordered a PET scan at the time to be able to get a closer look. The results was sure. She was sure was sarcoidosis, but the problem is that cancer and sarcoidosis look the same. In the scan, the same scan. On January 26, 2018, I had my first needle biopsy, which showed no cancer. I had periodic breathing tests and PET scans throughout 2018 and 19 until a certain lit up section was forming a specific shape, looking brighter on the scan. I had a second needle biopsy October of that year. The test results of the biopsy were not clear, as one person looking at the same sample said it was sarcoidosis, the other one said it was cancer. This moment I thought back when I was 25 years old, lit up my first cigarette. I smoked 1.5 packs a day until 2004 when I watched my dad die from emphysema. I cut back the amount that I smoked to 1 pack per week, quitting off and on once for a year, only to start up again when something would go wrong. And I needed my crutch again. The chance of cancer was a possibility on my biopsy. I quit right there and then. I haven't smoked for over a year with no desire to even start again. To absolutely rule out cancer, an appointment was made with Dr. Lazar at UPMC with the intent of taking a bigger sample of the tissue in my lung, which would require surgery. The surgery took placed on December 19, 2019. During the surgery, it was discovered that the sarcoidosis was preventing Dr. Lazar from getting the biopsy from the area in a less invasive way. I had to have an incision under my arm where he went in from the side, deflated my lung, parted my ribs to try and get the sample from this spot. After the surgery, Dr. Lazar told my wife in the waiting room that as the results had tested positive for stage 2 lung cancer, and the area could not be removed because there was a major artery involved, and if he would have tried to take it out, it could have killed me. I spent 4 days in ICU, and it was an emotional time of healing and hallucinations from oxycodone. I remember sitting on the recliner in my hospital room feeling as low as I ever felt in my whole life, not knowing where things were going from here. When I looked up, I saw our pastor from our church standing there, and I felt peace. We talked and prayed together, and I felt hope. And there was hope, and it continues to be. My time at the hospital was physically and emotionally difficult, but the staff in the hospital helped my stay there be more bearable, and I was very grateful for everybody. I left for home December 23rd, 2019 with the oxygen concentrator that I needed to use when I laid down, and my supply of oxycodone to ease the pain. The oxycodone was a blessing and a curse, as I was still having hallucinations and trying to wean myself off them by replacing them with ibuprofen and Tylenol. The latter two did not help the pain, and I found I couldn't sleep without oxycodone. It wasn't until the last week of December when my son-in-law mentioned to me that he had the same problems with certain strong medications he had taken, and the doctor advised him to cut the pill in half. I immediately tried that as I was desperate for relief from the pain and lack of sleep. The half pill was just what I needed to be able to control my pain, finally get some sleep, hallucination free. That and the earplugs to cut down the loud noise from the oxygen concentrator. On January 29th, 2020, I had my first appointment with Dr. Scholey at the Hillman Cancer Center. At that point, I learned that I had fluid around my lungs that meant that the cancer was now stage 4. The following Wednesday, I had my first experience having blood drawn, seeing Dr. Scholey, and having my first chemotherapy treatment. My wife and I had an eye-opener, seeing how many patients were in the waiting room and the infusion room. Once again, the staff was extremely kind and helpful in everything. It was explained to us with patience and great detail. It was an extremely emotional, overwhelming, long day, and we went home tired, our hands filled with papers, our minds filled with instructions, but still hope. The first day after the treatment was uneventful, and then the effects from the treatment hit on day 3. I was extremely tired, so I never left my bed that day. Food had an awful taste to me, and I had a hard time getting anything down. I was losing weight, coughing nonstop, and very weak. It was a very emotional time, and I was feeling very low. I knew many people were praying for me not just at my church, but others who heard about me over many prayer chains. And I had phone calls, visits, cards from family and friends from my church, which were all uplifting, and I needed it most. My faith in God and the prayers and how much people cared kept me going. My next appointment was with Leslie, the CRNP at the Cancer Center on January 22nd. I managed to walk into the building, go up to the elevator and to the waiting room before I needed to request a wheelchair because I didn't have the strength to walk anymore. I told my wife while we were in the waiting room that if this is what life is going to be like from now on, I don't know if I want to continue with treatment. Her sister's husband had lost his battle with cancer in 2010, and she remembered him telling her that he wanted to discontinue the treatment because life wasn't worth living for him anymore. My wife told me right then that I was the one going through this, so it was my decision whether I wanted to go on. During the appointment, I told Leslie how I was feeling. I was so very weak from all the coughing and had such trouble breathing and how very poor I felt. From there on, we went to have an x-ray taken to see why I was having such trouble breathing. Afterwards, we met with someone from Dr. Lazar's office who showed us the x-ray, how the bottom of my right lung was compared to the left one. The problem was that a major nerve was damaged during the surgery and my diaphragm moved upward, compressing the bottom third of my lung. We were told it may improve over time, but after 10 months, there has been no improvement and nothing can be done. Leslie prescribed something called Telsin pearls for my coughing, and we picked them up at the pharmacy on the way home. These pills were such a blessing and took care of the coughing immediately. I started getting my strength back. I could sleep again. From that day, I had 2 more chemotherapy treatments and then continued on just the Keytruda immunotherapy infusion every 3 weeks. The first PET scan after the treatment showed the cancer was shrinking. In April, I had my first appointment with Dr. Ranasauryia since my surgery. She noted a new area at the top of my right lung. It was lit up on the scan, which she suspected was the sarcoidosis coming back. She started me on a new regimen of prednisone to see if the area would shrink so she could be sure it was not a new area of cancer. My next PET scan was August, which showed the cancer being contained and not as bright as the new area. That right now is still assumed to be sarcoidosis. Treating lung cancer along with sarcoidosis is a complicated thing to do, and as of right now, we are awaiting the next PET scan around November this month, and we'll go from there. Complications from the prednisone have caused problems with my blood sugar, and I'm now trying my best to keep that under control with diet and movement. Another complication, which they are uncertain if it's coming from off the prednisone to a lower dosage or from the Keytruda drug, is my muscle weakness and joint pain. I am now taking Celebrex for this, as well as receiving physical therapy twice a week in hopes this will improve. This ongoing journey has made me very thankful for the companies who provided the drugs and the many, many caring UPMC employees who God has placed into my life and touched me in so many ways, and continue to do so. The nurses in the infusion center are absolutely amazing. To watch them go from patient to patient nonstop and still show so much patience and kindness to each person is so moving, and I appreciate them so very much. I am extremely thankful for Geisinger Health Insurance, which has eased the financial stress during this time. This journey has brought me even closer to God and made me so very thankful for all that He has given me, and also made me realize what a wonderful church family and pastor I have, who have supported and prayed for me every step of the way. I have come a long way from that day in the waiting room when I didn't want to go on. For those who have recently been diagnosed with cancer, my advice would be to give treatment a chance, even though it may be overwhelming in the beginning. My faith in God was extremely important in my overall outlook and how I deal with everything from day to day. My journey still continues with much hope and lots of prayers. Thank you.
Jim, thank you. You have shared very personally, and you have shared just how lung cancer affects every single aspect of our lives. And we just thank you very much. We can learn from what your experience has been. Now is the time that we'll figuratively shine a light on lung cancer by paying a tribute, first of all, to patients with lung cancer. I would like to give you courage. Your illness does not define you. As Muhammad Ali said, don't count the days, make the days count. May you live and have courage to live it well. To the caregivers and family members and loved ones, be encouraged. This is a quote from Leo Buscaglia. Too often, we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around. Caregivers, your involvement is powerful. To those we celebrate, and everyone touched by lung cancer in our community and around the world, let's take a moment of silence to remember. We thank you so much for your time as you've joined us with Shine a Light on Lung Cancer. I'd like to thank again Dr. Ranasauryia, Jim, and behind the scenes Amy Brink, who is with UPMC Marketing, has put much effort into the marketing and coordination of this live event, and we thank each and every one of you. Good night.